Lives not from.
All right, everybody, good afternoon. Thank you so much for watching Fox News Now. Ron Hoon and Pilar Arias here. We've got a special hour live coronavirus only coverage that we're doing online. We're also streaming on YouTube. We're on the new Coronavirus Now website that we just launched. And some stations in our group might be taking us on Facebook Live as well. So we're getting out there.
We are joining you from Phoenix, where every day at 9 in the morning, the state of Arizona updates the number of cases. They are relatively small here in Arizona, but boy, we see developments happening here in the West, Pilar, just literally in the last hour or so that, frankly, I think until this, it is now officially, by the way, a pandemic from the World Health Organization. Before we got to this point, I didn't think, probably most folks thought we would never see something along these lines. For example, we take a look here at the Dow. It is getting closer, unfortunately, to the possibility of a 7-point drop, which, if it were to hit that, would be the second time this week that we have seen the so-called circuit breakers kick in. It's been an ugly day on Wall Street, and as opposed to yesterday, where it started with an 800-point gain, gave it all up, went negative for a while, and then came back and still had about a 1,000-point gain. There right now doesn't seem to be any bounce. We're into the final hour of trading.
Right.
Down 1,438 points. Again, if it hits 7%, they will kick in the circuit breakers, and the system will work the way it's designed. Now, here's one of the points I want to bring up, Pilar. So this is from the Golden State Warriors. There had been, if you've been watching some of the talk, like Pilar and I like to do, maybe catch a little bit of sports talk once in a while.
Of course we do.
All of the talk has been, okay, so what's going to be happening to these events? And even days ago, you might have thought, oh, that's hyperbole. They will never start playing games without anybody in attendance.
Right, in the audience. Right.
Here's what has just transpired. This is from the Golden State Warriors Twitter page.
Feel free to hold it up, Ron.
Within this past hour. I'm going to just hold it up for you right there. It's a little bit difficult to see, but matter of fact, I'll just read it to you. How about this? Due to escalating concerns about the spread of the coronavirus and in consultation with the city and county of San Francisco, tomorrow night's game versus the Nets, so that would be the Golden State Warriors versus the Nets at Chase Center, that brand new, beautiful stadium that they built there in San Francisco, is going to be played without fans.
Yeah.
Fans, by the way, they say with tickets to the game will receive a refund in the amount paid. It was just a couple of days ago that LeBron James was talking about, hey, I play the game to play it in front of fans. Then the next day he came out and said, I wasn't aware, at about the same time we were talking about it, that the top brass at the league, the people who really pay attention to things like this, we're holding meetings to decide where we go from here. We don't hear anything in terms of a national ban yet. This is obviously, we're out of the NFL. Right now we're right in the heart of the NBA. Out here in Arizona, it's spring training time. People are still going to the spring training games.
I just went on Saturday, Ron.
Was it pretty busy?
I went to the Salt River Fields at Talking Stick for a Padres Diamondbacks game, and that was a situation where they had a split squad. They had half at wherever the Angels play. Where did they play?
Further out. But when you talk about the going to the game, was it busy or no?
Ron, they posted on the Jumbotron that they had record attendance. I think it was more than like 12,000.
Yeah. And I had some family members who came into town to see the Giants play, and they said it was very busy. They play in Scottsdale at that stadium. So basically what happens is people book their tickets. They're already committed to coming to Arizona. They fly in, they go to those games, and then they leave. Now, at the same time, we heard, Pilar, as you show the numbers up on the screen of the total number of confirmed cases inside the United States. That's a number that we've been going with for the last few hours. We had one of the airline CEOs use the word breathtaking to see what's happening. Maybe not so much with travel today or 3 days ago, but in terms of advanced bookings for the airlines. His prediction, we're talking about the CEO of Southwest, was this could be as bad for the industry as 9/11 or even worse. So there are some real questions just about economically, how how long is this period going to last?
Right. I think we all wonder that.
Right. And B, just how will the economy survive? They are working, from what we're told, on various plans in Washington to try to come up with some sort of a package that can provide people with some stability, some sense of, hey, if I do get this virus, I've got a way to get tested, I've got a way to have coverage, that kind of thing. They're working on all of this, maybe payroll tax relief in Washington. There's a lot in the works there because that's the big unknown right now.
Right.
I mean, we can look, Pilar, at China to see how the rate of growth was capped. And we can also take a look at even South Korea is starting to see a slowing in the growth of their numbers as well. So, I mean, South Korea, they actually set up drive-through testing clinics where people could come by, just literally drive through and get tested.
Yeah.
Here in the U.S., we're still kind of ramping up. Of course, everybody hopes that the system will be up and fully working, if not now, within a matter of days.
Ron, we're in the business where we follow things, social media, major cities across the U.S., everything we stay on top of. We are information seekers, so to speak.
Right.
We go when we look for it. But I feel like a lot of people, some people are thinking this is a little bit of information overload. This is a lot to take in. Every city, every county, every state is holding their own news conferences. They're talking about their cases, the presumptive positives, the testing that's being done.
Right.
And it is a lot to take in, right?
You know, it is. But I mean, I think what you have to look at, the answer to that is, while the flu kills a larger number of people than this coronavirus, at least so far, it's the death rates. Those are the things that are concerning. If you look at the numbers out of Italy, let's pull it up here, for example.
I will.
I know you've got the map up where we can look at any nation on Earth. Let's pull up.
Johns Hopkins University, by the way, doing this. Which country do you want to look at?
Italy.
Italy.
Right,
The
so
second country.
Yeah, second
okay, here we
worst
go.
next to China.
Why is that not acting
And
right?
so,
Hang on, let me refresh this page. We can take a look here.
here we go.
It's funny how we can see all these works. Here we
Okay, so Italy is reporting 10,149 cases. The number of deaths in Italy is 600. That's a 6% fatality rate. That's concerning. The regular flu is nowhere close to that.
Right.
So when you see 6%, I think that really is cause for concern. In Italy, they've taken the most drastic measures that we've seen anywhere in the world, with the exception of China, where basically you've got the whole country in a form of lockdown. And every nation is going to have to make its own decision in terms of how it proceeds.
Yeah, absolutely.
So I do think, I know there are a lot of people out there like, this is a bunch of hype, but if you see a 6% death rate, you should be obviously concerned about it. Now, clearly, one of the things they're going to be investigating as the weeks and months go by is, why does it appear that children, both in China, the United States, or anywhere else around the world, don't have necessarily an immunity to it because it's a new virus. We haven't built up immunity. But they do seem to be able to handle it with relatively mild symptoms. And yet then, Pilar, and I know you've seen some of these numbers, it's if you're 80 years old or older, the death rate there, at least in terms of the analysis they did in the country where most of the cases came from, which is China, 21% fatality rate. That is very concerning. And one of the reasons it's concerning is it appears that you have a few days, perhaps as many as 5 days, while you have been infected where you are symptomless. And during that length of time, what if you go to visit an older person? Their immunity, they have, again, no immunity, but their ability just to fight the disease for whatever reason is severely compromised. I think that's the greatest concern.
Yeah, absolutely. Ron, thank you for joining us to at least start this coronavirus only special online digital stream. I'm going to head to Los Angeles County now, our neighbors just to the west. They are holding a live coronavirus related news conference. They're one of the areas that seems to be doing it each and every day just to update the general public for what's going on there. So we're going to listen in live right here on News Now. Thanks again, Ron.
Yep.
Thus, take the steps you need to take today. Protect your health. Protect the health of everyone else in our community. We will be asking all of our businesses, all of our event venues, to put in place the plans that they need to have should we continue to see an acceleration of community transmission that calls for more social distancing. More social distancing could mean going to spectator-free sporting events. It can certainly mean canceling large events throughout LA County. And while we're not there yet, we do need to get prepared for the eventuality that we will see many more cases, and because of that, we will need to all do a lot more social distancing. I like to say that when you don't have a vaccination that allows you to protect yourself and also protect others who may be more vulnerable for serious disease, the next best tool we have in our hands is social distancing. It accomplishes the same thing, although it's less effective. It actually allows people not to be in close contact with each other in hopes that that slows down the spread of an infectious disease. We are very hopeful that our healthcare system can continue to provide all of the services to everyone who needs care, but that means not overloading the healthcare system. And there's two asks there. One is, again, do the social distancing and stay home when you're sick so that you're not, in fact, spreading infection. And the other is that you please call ahead and speak with your provider before you go in to see a provider, and particularly before you go into a hospital. Our emergency rooms are for people with emergencies, and let's make sure that our emergency rooms continue to have capacity to treat everyone who is there because they have an emergency. I'll open up for questions now.
Doctor, on the convalescent homes, on the convalescent homes, you mentioned the elderly. You're having the inspections. Can you tell us, are you at the point now where those people there are safe? Should people who have loved ones in there be more concerned? Should they take them out? And are you anywhere near, I know there's a lot of questions, are you anywhere near saying to those people,
sure,
no visitors, leave them alone?
Yeah. So where we are is we are working, as you know, we're giving everyone technical assistance. Those are our skilled nursing homes and our long-term care facilities where people are already ill for the most part. And yes, we are working to make sure they have good infection control processes in place. We're also working really hard to assess at what point do they need to completely limit visitors. I will say right now the big plea is that they institute policies that all employees and visitors coming in to the facilities do a self-screen to assure that they're not coming in with any kind of illness or respiratory illness symptoms.
Right here.
Can you tell us more about the woman who died from underlying health?
The woman who died did unfortunately have underlying health conditions.
And how many, I'm confused about the total number of cases in the county.
Sure. There are 24 cases that we have reported and 3 cases that were announced by Long Beach. So the total right now for LA County is 27 cases.
And that's including the woman who died?
That's include. Yes, it is.
Okay, in the back and then right here.
Where did this death occur? Was it in Los Angeles County? And secondly, San Francisco is banning all gatherings more than 1,000 people, and you said we're not there yet. Why not here?
Yes, it's a great question. Let me start with the first question. The person was visiting and she was hospitalized, and shortly after being hospitalized, she unfortunately passed. Here in LA County. That's why we're reporting it. But she's not from here. She's not a resident here.
And the thing about the San Francisco,
sure,
banning large gatherings, you said
yes,
we're not here yet.
Yeah. Well, we actually have developed a tool that we use that assesses risk based on how much community transmission we're seeing and how much what the acceleration is in terms of the number of positive cases, and we're trying to really use that to drive our judgments about when things need to close. So I will say, we're working with all of our partners at all of the different sectors so that they understand what that criteria looks like and that they're making plans and they're prepared for announcements that may in fact be similar to the announcement in San Francisco.
Doctor, you were talking about the distancing. What does that do for mass transit, public transportation?
Yeah, I want to say I've talked with Mr. Washington over at Metro, and he's doing a lot more frequent cleanings, a lot of making sure that his employees are also protected and know what, are taking good steps around their own sanitation. And he's also doing his part around making sure that employees who are ill are not coming to work. We do ask people, again, if you're using public transit, particularly if you're using public transit, don't get on public transit if you're sick, even with mild illness. Try to keep your distance and your space where you can. Where you can't, make sure that when you get on and when you get off, you're using hand sanitizer or your preferably you could get to a washroom and wash your hands.
Do you have any message for homeless if they keep them home if they're sick?
So we're going to urge people experiencing homelessness here in LA County, if you are sick, this would be the time to get yourself to a shelter or to one of our clinics. We're working hard with our outreach teams to make sure that they're identifying people who are sick and try to get those people into the appropriate care facility.
Hi, I'm sorry. About the woman who passed away, we were here. Is it in the Boulder Park area? Are you able to say that?
Was she in the
area of the county?
I don't actually have that information.
Thank you.
I mean, I do want to say I know the question comes up a lot, like, I want to know, is this case in my neighborhood? At this point, these cases are scattered throughout the entire county. There's no supervisorial district that does not have a positive case. Because we also know there's a lot of cases that have yet to be diagnosed, we at this point say to everybody, you need to be aware, you need to expect that there's community transmission if you're here in LA County, and you need to take the steps you can to protect yourself and the people you love. And you need to help us protect particularly those who are most vulnerable for serious illness.
My question is about testing. Oh, sorry. My question is about testing. Yesterday, Governor Newsom said that the test kits California had received from the CDC were missing reagents that had limited the capability to test for the virus. Could you comment on how that has affected LA's ability to test? And in addition to getting that reagent from the CDC, what other plans does the county have for rectifying the testing delays and the limited capacity it's been experiencing so far?
The testing issue continues to haunt us in many ways, and I appreciate your questions and your patience that we don't actually have all the answers. We are very dependent on getting reagents from CDC. I know that both the president and the vice president were assuring us and the general public that those reagents are coming and coming quickly. I do want to also announce that we have 2 commercial labs that are also doing testing and increasing their capacity. So I'm hopeful that we're moving into an era where it's a lot easier when providers order a test for those tests to happen. I do also want to commend our Department of Health Services is looking into opening up labs in their facilities as well, which will allow them both to collect the specimens there and be able to process the tests.
Doctor, nurses associations are squawking very loudly that A, they're not protected enough, and B, the hospitals wouldn't be ready if this influx really would run out of beds, run out of emergency rooms. Can you comment on that?
Sure. We have a wonderful system of sort of cooperation and collaboration amongst all of our hospital partners. As I noted yesterday, I was very honest with the number. We generally have about 1,000 beds that are free on any given day that could be used for a surge in illness across our hospital system. That being said, I still want to note that should people be seriously sick and need, for example, to be seen and provided services in an intensive care unit, we could overwhelm the system if we're not very, very careful about doing everything we can to slow the rate of transmission. And that's one of our goals, is to make sure that we, in fact, try to slow the rate of transmission here so that we can, in fact, protect our healthcare system. I also want to note that we know that the only way the healthcare system can keep running is if the employees who work there, all of the employees who work there, ancillary staff as well as the clinicians, they too need their protections. And I'm disheartened to hear that some nurses are saying they don't feel like they're well protected. My sense from talking with certainly the county hospitals is they're doing everything they can to adhere by the guidance and the directives that are issued for licensed care facilities.
All right, everybody, we're going to be switching gears here on Fox News Now. I wanted to show you the Dow Jones Industrial Big Board, how stocks are doing. Currently down about 1,600 points, nothing but red today. Not good news. It's been a very volatile week for the markets. First, it was severely down, then up, now down again. and they have about 40 minutes left of trading. So we're keeping a very close eye on that. I'm seeing we're getting an additional live event coming in now. It looks like some regular citizens of the general public are speaking about protecting patients' public health. And I just got word that this is the National Nurses United holding a day of action to demand better COVID-19 protections and protest employer and government in San Francisco, California. So it just looks like there's a reporter interviewing this woman, but let's listen in live here on Fox News Now.
Show any symptoms. This is a time, and again, it's spreading. We're seeing community spreading, and we need to have the utmost protection to stop it. It's not a time to dial down protections.
And this is a premier institution in the world, UC San Francisco Medical Center.
Yes.
What does it say when you report here that you have to reuse masks? I mean, Governor Newsom, what do the regions think about this?
I think there's two things about that. It's a symptom of our broken healthcare system, right? And our economy. Some of that. There's a lot of pieces to, right? But UCSF has told us proudly that they have the largest supply of PAPRs in the UC system. So hopefully that'll help us. But we need.
Have you ever had to reuse masks in the past?
The N95s, yes. They say some of them you can use up to 8 hours. So yeah. But in a critical situation like this, we all agree that we would not reuse a mask if it's a known positive patient.
And other healthcare workers in Korea, Japan, and China have themselves been infected because they haven't been properly trained. What you're saying is that there's a possibility of that happening. It may have happened at Kaiser as well, in Roswell.
We don't want to see that happen. Nurses believe in anticipating the needs of patients. We believe in prevention. We do not want to see that happen. So that's why we're saying there's no need to dial down protections. We want to make sure that no more staff are infected, and of course we want to see this virus stopped.
And people that are infected or contaminated, for example, the crew at the Grand Princess who were on that ship, should they be evacuated? That's a question. The government has said that they should stay on the ship and it should sail out to sea. What do you think about the idea of sailing out to sea with a contaminated ship?
I don't know. I'm focused here on our patients and our nurses. That's out of my hands.
Okay.
Yeah. Thank you. Thank you.
Okay. All right.
JC, you don't want anything more?
All right, everybody, I'm going to bring you right back out here to Arizona. We just lost that live picture really quickly. Bailey Miller is joining us live, and we are talking about what the Seattle Mariners are doing in terms of their games and spring training and what they're going to do once the actual season starts. So, hey there, Bailey, what can you tell us?
Hey, yeah, obviously we've been seeing major sports teams. They've been keeping a very close eye on the coronavirus. We've already seen across Europe that they've closed down some of their arenas, but now we're seeing some U.S. teams and right here in Arizona following suit. So as you guys know, we're standing outside of the Peoria Sports Complex right behind me, and this is where the Seattle Mariners play their spring training games. So the Seattle Mariners have been out here playing, but we're hearing reports that they will be, we did get a statement earlier today that the Mariners, they will move their home games from Seattle through the end of March due to Washington State banning large events. And we're hearing reports that they may be having their opening game here in Peoria. We're still waiting for confirmation on that. We put in calls and we're waiting for a final statement from the Mariners on that. But I'm sure people out here for spring training, people, Seattle Mariners fans that live out here in Arizona will be thrilled to hear this news. And other sports teams, like I said earlier, they are following suit too. We're hearing that the Warriors, they are also hosting their game tomorrow, and that will not have any fans inside their arena during their game, during that NBA game. So we will be talking to fans out here of the Mariners later today, and you can see it's a rainy day, so it's a little bit like how it is in Seattle. So they'll be out and about, so we'll talk to them about how they feel about this if it were to happen. So we'll be getting some confirmation hopefully pretty soon. I'll send it back to you.
All right, Bailey Miller, thank you. But I did want to ask you really quickly, because I'm sure our viewers are going to want to continue to follow this story throughout the day. Which shows are you going to be reporting in later on?
Yeah, I'll be in the 4 o'clock show. We'll have the best updates there, and then I'll also be in the 7 o'clock show on our extra channel on Channel 45.
Perfect. Well, thank you so much for joining us live, Bailey. Really appreciate it.
Thank you.
All right. So again, everyone, my name is Pilar Arias, one of 3 Fox News Now hosts, bringing you this live digital coverage 1-hour coronavirus special. Now, I do want to show you, we have been listening in on News Now on Fox 10 Extra, which is from 10 a.m. to noon on Channel 45, Cable 9. If you're not in Arizona or you don't have a TV, that's not a problem. You can always find us online by going to fox10phoenix.com. So I'm going to take you to Capitol Hill now, where the House Homeland Security Committee is having a hearing on confronting the coronavirus, the federal response with acting DHS Secretary Ken Cuccinelli. Listen in live right here on Fox News Now.
And the efforts to combat and contain this novel coronavirus. Secretary Cuccinelli, thank you for mentioning in your testimony the work the DHS is doing to keep our frontline employees safe, especially given that the nature of their work leads actually to a higher risk of exposure. You mentioned in your testimony that all CBP personnel have access to personal protective equipment. Can you assure us that there is sufficient equipment for all personnel at CBP, and do you believe additional funding is necessary to ensure the ongoing availability of this protective equipment?
Congressman, tracking PPE for our employees has been something we've done from day one, well back into January. We are comfortably ahead of that curve. We keep a stock of 30-plus days on hand. We would probably say we have around 45 days available. That's standard for us, and we're not seeing a threat to that. We're not seeing a drawdown at a pace that is cutting into our ability to maintain protection and protective gear for our employed workforce.
Thank you, Mr. Secretary. On another matter, the lack of a full operational control of our southern border is something of particular concern to many of my constituents. Since taking office, President Trump has repeatedly asked for additional funding for the border security, including hard physical wall infrastructure. That has either gone unfunded or ignored by Congress. Briefly, Mr. Walker said this, but given the control that comes in and out of our nation is at the hands of CBP, it is imperative that we seek to prevent this novel virus from coming in through our borders. Do you agree that fully funding the President's budget request for border security is necessary for the protection of our country?
Well, certainly we do, Congressman, and the way you phrased it, border security, speaks to the comprehensive nature of the strategy we need to employ, which includes the whole wall system, but it also includes our people. The folks in the Border Patrol and in ICE who back them up, at USCIS who do much of the processing. That entire system is necessary to maintain security on our border. And one of the things, you know, every month you all see the numbers of apprehensions and so forth, but what doesn't get talked about as much is what we call the getaways. There are plenty of people who are not caught. And when you think about that in terms of communicable disease, that takes on a whole new threat. It has existed with other communicable diseases, measles, to name one, TB, and we do see them in across the United States at levels that many communities haven't seen in some time because of the situation at the border. We are not yet having a coronavirus problem at the southern border, but we are planning for such a problem as we see the case numbers in South and Central America rise precipitously as we are in other parts of the world.
Secretary Cuccinelli, you talk about individuals who are apprehended and those who get away. Have you apprehended individuals from China or other nations where we have known cases of the coronavirus?
We have not yet apprehended anyone crossing illegally or, well, I'll speak to legally in a second, who has tested positive for the coronavirus. We've apprehended almost 400 Chinese nationals since January 1st. No positive coronavirus tests amongst those individuals or any others at this point. We have also, based on the 212F proclamation the President implemented on January 29th, I should say 31st, effective February 2nd, we have turned away people from many countries of the world because they had been in China or Iran in the previous 14 days. And the number one category of foreign nationals we've turned away are Canadians. Chinese are second at our land ports of entry under the 212F authority. So we don't know who amongst those folks had what medical condition because they were turned away.
Thank you, Mr. Secretary, for your attention to this subject. And I yield my remaining time.
Mr. Cuccinelli, just wanted to follow up on that. Are you all testing every apprehended individual from an affected country?
I'm sorry, I'm sorry, ma'am.
Are you testing every individual apprehended from a coronavirus affected country?
No, we are not. No, we're not.
So you just said that there, out of the 400 Chinese nationals, that there was no coronavirus found. So how many of those 400 were you testing?
I don't know how many we've tested. We don't test unless we observe symptoms. Again, using already existing protocols. We're not creating yet new protocols to deal with potential coronavirus sufferers.
Right.
We deal with them as we would any other immigrant that we encountered. And of course, setting this virus entirely aside, one of CBP's roles, though not medically trained, is to observe those coming into the country for symptoms of illness in general.
Absolutely. Yeah, we're very well aware of the screening standards, passed a bill to that end out of this committee. Would you be willing to submit to us in writing a summary of those tests that CBP has performed on migrants apprehended at the southern border?
I would be happy to go determine how many immigrants we've tested for coronavirus.
And submit it to us in writing to this committee?
Yes.
Promptly, please. Thank you, sir. The chair will now recognize Mr. Rose from New York for 5 minutes.
Thank you, Madam Chairwoman. Mr. Rudd, would you agree that we will not be able to test nearly enough people without automated testing approved in our state laboratories?
I think that kind of testing is being done at the commercial scale. I'm not sure it's necessary in the public health scale side, and that's where these different roles that the two types of testing play.
So maybe I'm confused about something. My understanding is that automated testing needs to be approved by the CDC in conjunction with the FDA before it can occur in any laboratory, private or commercial or public.
There's a process of emergency use authorization, and that is an approval that the FDA grants to do a test that is earlier in development.
And you review it, though?
Well, we develop it. We basically...
So is it exponentially increases the number of tests that can be conducted in one day? It's significant. And we need for it to happen as quickly as possible. You would agree with that?
Right. I think that's right. I think whether we do that on the commercial side or in the public health side...
I don't care what laboratory is doing it. It's got to happen.
Exactly.
Has any laboratory in the country been approved for automated testing yet?
I can check on that. I can tell you that the LabCorp and Quest use those kind of systems, and they've been approved.
So is it happening anywhere in the country?
It's happening in those laboratories.
Okay, because it's not...
Let me verify that.
There's a difference between semi-automated, there's manual, semi, and then full automated. We have to get to fully automated, correct?
Let's check.
Because I can tell you not one laboratory in New York has been approved. Can I have your word here publicly that you will make this a top priority to get not just in New York, but as many laboratories across the country approved for this as quickly as possible?
I think we want the same end, which is to have really every person that needs to be tested be able to get that test done the day that they need it. And to that end, I think the exact means that you use to get there, I don't want to quibble about that.
But you do agree we can't get there without automated testing?
Some level of automation, certainly.
Some level. Okay, so thank you for that. I look forward to working with you and your team to get New York there as quickly as possible.
It's a high priority, and I think what's going on there is something that we're working very closely with the health department on.
Do you have any sense of a timeline for how quickly we can get to these automated testings approved in New York?
Well, I think that this is not a problem that we can test our way out of. I think that that's part of the overall strategy. We need to be testing so that we understand where we need to be intervening, and we understand the effectiveness of those interventions. So actually, I don't think for public health purposes, every single person doesn't need to be tested. For example, in the influenza pandemic 10 years ago, we weren't able to test everyone. We didn't need to test everyone. our public health interventions were guided by the ability to extrapolate from the laboratory tests that we had.
Of course.
Different for clinical
Absolutely. Those who have symptoms, though, those who are symptomatic should be able to be tested same day. And we can't do that without these testings. It's necessary, it's not sufficient.
Right, but especially for clinical purposes. The public health, doing a representative sample doesn't help you if you're the patient and your doctor's
Absolutely. So my apologies in advance that we're going to be contacting your office every single day until this happens in New York and across the country. Mr. Cuccinelli, thank you for your service. Want to talk to you about foreign travel. Is my understanding that those foreign nationals traveling from China and Iran are now tested upon reaching a domestic airport. Is that correct?
No, that is not correct. They are barred from entering the United States.
Okay, so in terms of foreign screenings, though, which nations are we doing screening at?
So the way it works is the 212F only covers foreign nationals. The president doesn't have the authority under 212F to do anything to you and I as United States citizens. So U.S. citizens, legal permanent residents, and their families come in. Those are the people being screened at the airport. So an American citizen flies from China, and there are still some flights, to one of the 11 airports. They encounter a CBP OFO officer, the blue uniform folks you see when you come from another country. You show them your passport. Now they're going to see you came from China, and they're going to send you to secondary screening. That screening is run by CWMD, our contract medical personnel. And unlike the traveling questions that CBP asked you, they're going to ask you medical questions. These are medically trained personnel.
And this is upon entry to the United States.
Correct. At the first
is there
point
any consideration of expanding that to other nations that are hard hit by this, Italy, for example?
Yes, there is regular consideration of that.
Okay. Do you think that's a good idea at this, knowing what we know right now, to expand that to South Korea, Italy?
Well, in the particular cases of South Korea and Italy, those allied nations took very quick affirmative steps to start performing exit screening. They are essentially doing on exit what our medical screeners would do on entry. And they did that in part to avoid being swept into a 212F situation. And that was acceptable to the president's task force, and he accepted it because of their transparency. These are allied nations who are being very upfront with us about what they're receiving. Sure. And they're also barring passengers who, for instance, test over 37.5 degrees centigrade for a temperature, just to use an easy one.
All I ask is that please keep us posted on your analyses going forward as to whether that should be expanded.
Glad to do so.
Thank you.
Okay, I'm going to wait for him to sit down. Okay. The chair now recognizes Mr. Bishop for 5 minutes.
All right, everybody. Well, they're taking a little breather in this hearing here. Things getting a little bit contentious on Capitol Hill regarding the federal response to coronavirus. I wanted to break in here really quickly and show you some breaking news that we are getting from Seattle Public Schools. Now, this is going to be coming directly from their website. I'm going to show it to you right now. I'm going to read to you what they are saying. Now, I know there's a lot of words here, and it's a zoomed out picture, but I'm going to provide you the highlights. Seattle Public Schools COVID-19 updates is what the headline is. They are saying that starting tomorrow, March 12th, Seattle Public Schools will be closed for a minimum of 14 days. Now, 14 days, calendar days is what it sounds like. Beginning Thursday, all school building activities, including school day instruction, childcare, health services, enrichment, etc., are canceled until further notice. Please read the latest update from Seattle Public Schools regarding COVID-19 below. So again, this is the update, the March 11th letter to families explaining exactly what's going on for a minimum of 14 days as the Centers for Disease Control and Prevention, as the CDC currently guides. They're saying it's a necessary action and an effective way. This necessary action is an effective way to disrupt widespread infection. So again, beginning Thursday, March 12th, they say more information will be provided on Friday, March 13th. So we're going to keep a very close eye on that. Seattle, King County, Washington, essentially considered the United States epicenter of the coronavirus. So we're staying on top of all things for you here. Now, I do want to show you, we did have an interview this morning with a political consultant. Stan Barnes is his name, and he's from Copper State Consulting Group. and he's talking about the coronavirus in terms of political implications and major events and the debates and things of the like. So I do want to show you here. I've got three portions of his interview pulled for you. I want to make sure everything's ready to go for you. So first, he talks about a lot of different topics. It was a very great interview, but the first one I wanted to bring to you was talking about President Trump, so to speak. So he discusses how coronavirus may be an issue for the president politically. So again, this is an interview from earlier this morning. Let's take a listen to what Stan Barnes had to say.
That is a mystery and is put fear into the public. And it's going to have an impact economically. People are not gathering and things are being canceled. Monies are not exchanged. People are not going to restaurants. People are not traveling. You name it. So the stock market's already anticipating this, and all of a sudden the attitude of American people is tipping economically. My own guess is this is certainly not a benefit to the president. But I don't know that he will absorb the blame for it. I don't think the American people are going to punish Donald Trump for the economic malaise that comes from this virus thing. I just don't think they hold him accountable because of the virus. But people don't vote with their head in the aggregate. Individuals do, but people don't. They vote with their heart. And the heart, like they say in love stories, wants what it wants. And who knows how people are going to react to paychecks being lower, or hours on the job being less, stock market being down. There's all kinds of reptilian instinct that kick in for voters, especially for the President of the United States, which feels like you're voting for the guy to put his hand on the steering wheel of the country. And so it's a black swan event that does not help the president. But I'm, in the same breath, I'm not sure it somehow net benefits Democratic candidates. You can bet there's going to be a healthy amount of fear-mongering on it by Democrats who are looking for anything to run on. I mean, after all, it's very difficult to run against this president on almost any issue. It's easy to run against him on his own personality and style. And now there's one more thing. There is this mystery virus. And so that's going to be the 1-2 punch of Democratic politics is he's unfit for the presidency because of how he behaves, and look at this virus, he should have done more. And that's what I think is going to be the mainstream speechifying of Democratic rhetoric.
All right, again, that's Stan Barnes. We're going to continue to show you parts of his interview right here on the Fox News Now Our Coronavirus Digital Special. So he also talks about some of the panic surrounding the coronavirus and what it means for voters. Let's take a listen.
This idea that a panic is set in, no one knows where that goes politically. And I think it's going to have meaningful impact. It might even change the outcome of the election. It might even change the turnout of the election. I mean, if the virus grows and grows all the way to November, well, we don't know what's in front of us, but if it does, it doesn't take much to believe that turnout is going to be different. It might be lower, and it might be a different mix of people that decide they want to vote. And so it's the panic in the economy in the real world will echo in politics. But none of us amateur political scientists can figure out where that goes because I'm not sure we have a relevant recent example of which to lean on. So everything's a prognostication, and that's really a difficult thing.
Speaking of the Democratic debate, it's going to be right here in Phoenix, Arizona on Sunday. But as you know, there's not going to be a live audience. It's going to be an empty room. It's going to be right here at the Arizona Federal Theater in downtown Phoenix. Former Vice President Joe Biden, alongside Senator Bernie Sanders, the Democratic candidate for president right now in the year of 2020. It's going to happen in front of an empty room. So Stan Barnes, one more soundbite for you to play. He's talking about the coronavirus being the first topic in the debate and how Dems may use it against President Trump moving forward. So we're going to take a listen, and then we're going to head on over to New York City, where Mayor Bill de Blasio is doing well, they've also become one of those communities essentially doing a daily coronavirus update. It's all right next here on News Now's Coronavirus Daily Special.
I think no audience in the debate is a significant impact on the debate outcome. At my knowledge, it's never been done before. And as a Phoenician, I'm saddened that we're not going to get the full effect here with the traditional debate. But aside from that, I think it's going to have a wet blanket kind of approach or phenomenon on the candidates. I think they'll be a lot more solemn and introspective and take longer and interrupt each other less. And I think the whole thing will be dialed down and softer and somehow more reverent. It may end up being something that we like as viewers, as receivers of political information. It may be a better way to hold the debate. And it's really interesting that it's not 7 people up on that stage, but only 2. So it doesn't take much of a jump to think of Lincoln Douglas or some other long ago semi-mythical political debate in U.S. history where 2 people are on the stage and we all get to sit there and listen, and no one is interrupting, and no one's impacting from an external point of view with applause or boos or energy reaction. So it's an historic thing for an historic time.
All right, everybody, I'm taking you out live now to New York City, where Mayor Bill de Blasio just started their coronavirus update. Again, this is live. Let's listen in.
These dynamics. So I just want everyone to understand that at the outset. The scientific community is trying to understand this disease, and there's new information coming up every day, including from our own health workers here in New York City. All levels of government are trying to come up with the right strategic decisions, but based on information that changes frequently. I do want to emphasize, I think the situation in the United States of America is by definition different than, say, Italy. And I think Italy is different than, say, South Korea. And I think South Korea is different than, say, China, et cetera, et cetera. I think each nation is facing some particular dynamics and circumstances. And although it's valuable to look at what we learn from other countries, it is not the whole story. The comparisons are inherently imperfect. I do feel as New Yorkers, we, even when dealing with a crisis, we are blessed to have some very, very key and distinct factors in our favor. We have unquestionably the best healthcare system anywhere in the United States of America, and that's both our private voluntary hospitals and nonprofit organizations, and clearly our Health and Hospitals Corporation, our public hospitals and clinics. We have just a lot more and a lot better healthcare available, and a history of making healthcare available to people in a very universal fashion, and even more recently by guaranteeing healthcare for all New Yorkers, telling people healthcare will be available to them without any regard. Bless you. You sneezed properly. You get a point. A little bit more to the elbow, but you were close there. The fact that we're not asking documentation status, I want to really emphasize that. Anyone who comes for healthcare will not be asked documentation status. We want everyone to get the help they need. We're not in our public healthcare system stymied by someone's ability to pay or not. We're going to give them care. If people have insurance, we'll draw on that. If they can get insurance and they don't have it already, we'll get them on insurance. But we're not ever going to withhold health care from anyone who can't afford to pay for it. We're trying to demystify the process and get people help as simply as calling 311 or going online and finding out where they need to go. And again, always knowing that they can turn to our Health and Hospitals Corporation. So we do have that great advantage. A lot of healthcare, a lot of quality healthcare, very accessible healthcare, and equal opportunity healthcare. We also have the advantage of New Yorkers. New Yorkers are, I think it's fair to say, the most resilient people, certainly in America, maybe in the world. And I'm very, very impressed by how New Yorkers are handling this crisis, by how much they're listening for the guidance and acting on it, helping each other. We need that. Said the other day, and I'll emphasize, this is not just a crisis that the government takes care of for you and will call you when it's over. That's not how this works. Everyone has to be a part of solving this. So those good common sense, personal hygiene adjustments, as we just saw, make a difference. Watching out for those who are most vulnerable, the folks over 50 with those major pre-existing conditions. You know, making sure that we're following the guidance every day for folks who need to be quarantined, honoring the quarantine. These are all really, really important things that really will affect the trajectory. And so far, I think New Yorkers are really listening and really following through. So there's a lot of reasons to feel that there's a much stronger hand to play here than has been seen elsewhere. I also would say, watching particularly the example of Italy, and so many of you come from different communities in the city, so you appreciate where your ancestors come from. Well, my ancestors are from Italy, and Italy had a crisis almost before they knew it was, you know, upon them. I mean, the speed with which that happened in such an unexpected manner, such a fast trajectory, very different than what we've experienced so far. Now, we knock on wood, and every day has to be analyzed and assessed, but Dr. Barbeau and I and Dr. Perea-Henze and I, we got together on January 24th and had a press conference at OEM, telling New Yorkers that this disease would eventually reach New York City. Not a matter of if, but when. And outlining on January 24th all the precautions and preparations that were in place. Didn't have our first case, doctor, I think, till we said March 1st. So we had, 5 weeks of preparation before even getting a single case, as opposed to, and I say this with great sorrow for Italy, almost no preparation before they suddenly had a full-blown crisis. We have to look at those differences and understand them. That does not mean we're out of the woods by any stretch. We have a long, tough battle ahead. Dr. Barbeau said, and I've commended her for it, her assessment as a professional is that this will be till September. Could be less, could be more. But I want to just let that hang in the air for a moment. 6 months we could be at trying to get this under control and starting to resume some kind of normalcy. So when you put that into perspective of the amount of time we had to prepare, what we have to throw at this challenge against how long we will be working to resolve it, again, I think we have strengths here that a lot of other places don't have. Just a couple other points. The fear out there, everyone knows it's real, the anxiety, the confusion. Dr. Barbeau rightly has talked about, not only the physical health dynamics, the mental health dynamics, and reminder to everyone, there's a lot of very worried people. Anyone can call 24 hours a day, 888-NYC-WELL, and talk to a trained counselor. The anxiety is natural, it's normal. It's not like you turn on your TV and you get all the answers, right? It's normal. People would be worried even if they could get all the answers because it's a serious disease, but it's even worse when you can't get all the answers because no one has all the answers. So there's a lot of fear. The best way to fight fear is with information, is with good guidance by all of us, showing that we believe in each other and that we can get through this. That's what we're trying to do every day, and always tell people what we know and what we don't know, and the fact that sometimes what we know will change. The guidance could very well change. The decisions could change with new information. I will say very quickly, and I'm sure it'll come up in discussion, I have been reticent, for sure, and been in constant contact with my colleagues, reticent to take the kinds of actions that might cause a huge number of unintended consequences and other negative dynamics. Easy example, closing schools. And I appreciate the state and the partnership we've had to determine the right way to address a situation in a school. Not with a sledgehammer, if you will, but with a scalpel, not with a full closure of vast numbers of schools for long periods of time, but with a very pinpoint approach to addressing the specific school, the specific needs, and then getting that school up and running. Why? Because families depend on those schools for a safe place for those kids. Many families have no alternative. They have no alternative in some cases as a place to get their children quality food and nutrition. By the way, Families want to make sure their kids get educated. We all care about health and safety first. But the notion of losing months and months of our children's education should be very troubling to all of us. So we're trying to strike a balance. We could talk about this in many other veins. We're trying to strike a balance. Every day will be a new day in terms of assessing the information we have. So again, it goes back to giving people good information. We depend on you. Reassuring where we can reassure, being honest about what we do and don't know, giving people guidance about how they can comport themselves and what the best things to do are. Another very important message: we will not tolerate any discrimination. We will not tolerate any hate crimes. Right now, we've seen particularly troubling instances of discrimination directed at Asian communities, particularly the Chinese community. This is unacceptable. We've talked openly and honestly about the fact that too many hate crimes go unreported. I am beseeching you all to tell the members of your communities that if they are the victim of a hate crime, it must be reported to the NYPD so we can act on it, so we can find the perpetrator, so there will be consequences, so we can stop someone from doing it to another person. Any act of discrimination could very well be something that constitutes a breaking of the law of the city, which we have a very strong human rights law. So people are discriminated against in employment, in terms of their day-to-day lives, shopping, housing, anything. We want to know about it. We want to stop it. There's no discrimination. There are no hate crimes that are acceptable. But we have to tell people how crucial it is to report them. Anybody who wants to report such a crime or act of discrimination can call 311. And obviously that is available in many languages. So it's up to all of us to contribute to ending this crisis. Every New Yorker can help, and the information you spread really can empower people to do that. We want to get a lot of information out. This is it's guidance and safety tips, frequently asked questions. This is available now in 15 languages, and by Friday it'll be 23 languages. So this is these 2 pages, very, very important basic information we want to get out there. Please get this around to all your communities. It will also be available at nyc.gov/coronavirus.
All right, everybody, Pilar Arias still here with you. We are probably going to continue throughout the afternoon and into the evening, continuing to cover all things coronavirus for you, whether they're live news conferences such as this one. We've got our top of the hour coronavirus updates with numbers. We've got congressional hearings in regards to coronavirus. We've got live pictures of the Grand Princess docked in Oakland, California, where they have gotten about half or so passengers off so far, headed to their quarantine locations across the country. Some staying in California, some going elsewhere. So again, my name is Pilar Arias. We're officially wrapping up this hour of the dedicated coronavirus Fox News Now special, but I do want to show you the Dow Jones Industrial Circuit Breaker. Did not kick in today, but this is our current picture. We are actually going to be, trading is going to stop in about 3 minutes. It's currently down about 1,375 points. So nothing but red today on the big board, but still a very serious situation. A lot of people keeping a close eye on the stock market and their finances, 401ks, deciding if it's a good time of the year of ever, essentially, to pull credit, to purchase a car, to purchase a home, to refinance. So lots of people are keeping a very close eye on the stock markets and their finances, personal finances. And now we're hearing tax season, something unprecedented. The deadline of April 15th might even be pushed back due to the coronavirus outbreak. So again, lots of industries being impacted. Travel, there's deals for cruises, there's deals for flights. You're seeing pictures and videos being uploaded on all forms of social media of empty flights, just things that we've never seen before, we've never witnessed before, because people are just trying to stay cautious. They don't want to get sick themselves. They don't want their friends or family to get sick. They don't want to interrupt their life. They don't want to have to take time off work, for some unpaid time off work. So this is a situation that seems to be first and foremost in a lot of people's minds. A lot of people are paying attention, but since we are about a minute away here from the top of the hour, I'm going to show you the current numbers from Johns Hopkins University. Now remember, they're kind of the ones who have been keeping track of every single case globally, worldwide, not just here in the U.S. So this website is a great resource. It's a great tool. So you're seeing on the top left-hand side of the screen, total 124,910 confirmed cases. Total deaths, 4,589. They break it down by country. And on the far left-hand side of your screen over here, you can see even they go in order of the countries that have the highest cases all the way down to the least. So, of course, you've got China at 80,921 cases. For some reason, the map's not updating right here on the top left. But let's go all the way down to the U.S. So they're saying that there's 1,110 confirmed cases, 30 deaths, unfortunately. Now, Christy Larson, she's another News Now host, was telling me that she was listening to the head of the CDC earlier this morning, reporting that there was 31 deaths. So as you can imagine, these numbers are all very fluid. There's a bunch of different agencies reporting them at different times. You've got cities, you've got counties, you've got states, you've got agencies. So everybody's kind of monitoring this on their own level. But Johns Hopkins University is doing their best to provide us with these numbers. So again, top of the hour coronavirus update, total confirmed cases according to Johns Hopkins University, 1,110 and 30 deaths. But again, we're going to stay on top of this for you here, bring you all things coronavirus related on News Now. All right, and trading just finished for the day, so I'm going to show you here the big board. Dow Jones Industrial ended down about 1,467 points, close to that 1,500 mark there. It's just been such an uneasy week for finances and the stock markets. Not just the Dow Jones Industrial hit, but the S&P 500 and the NASDAQ as well. So I'm going to take you back to Capitol Hill, though. I do have some top stories pulled that are coronavirus related. Once these live events wrap up, I'll probably get to them as well here on News Now. But again, live is what we are all about. I'm going to take you back to Capitol Hill, where they're talking about the federal response to COVID-19, also known as the coronavirus. So thank you so much for watching News Now, whether you are watching online, on YouTube, on Facebook, however you have found us. Thanks for being here.